All right, I'm going to talk about confounding versus effect modification. So confounding is going to be, you have a exposure that leads to some sort of outcome, but you have a third variable that also leads to that outcome, and it can also mess with the exposure. So you're in this pickle. But for effect modification, you have exposure leading to some outcome, but you have a third variable that actually affects the type of exposure, and that in turn, this third variable is going to modify the outcome or the effect. This is the effect. Third variable is modifying the effect, but the exposure is still the same. However, the third variable for confounding, this can either modify your outcome as well as your exposure. So for example, if you say alcohol is related to lung cancer, and let's say smoking is also related to lung cancer, but in reality we know people who smoke and drink. Like people who drink also smoke, people who smoke also drink, and this is a confounding variable for lung cancer. However, if the vignette will say people that drink alcohol get lung cancer, but people that smoke and drink alcohol, so people that just drink alcohol that get lung cancer are, they would say like 20% or something, but people that smoke and drink alcohol, then the chances of that incidence of getting lung cancer goes even higher. This is effect modification. So the effect is the same, but when you're like multiplying both of these, the alcohol and the smoke, that creates a greater effect. However, for confounding bias, your smoking and alcohol are independent. Like smoking itself can cause lung cancer versus alcohol itself can cause lung cancer. So you don't know what exactly is causing this lung cancer, right? So that's a confounding variable.